excited to have Allison Ballard back, who is here to kick us off on the first day, pediatric nurse practitioner and clinical care coordinator who really helps run the program at Children's Hospital in Colorado, who's joined up with Melissa Wu, who is the Director of Clinical Engagement and Support now at the Muscular Dystrophy Association, to talk about social services and transition into adulthood. So I'm honestly not sure who is going first. Allison, maybe?
Yes, hi, good morning. I will be going first today. So I just would like to start off by sharing a story with everyone. And I think this story highlights the successes and challenges and also the barriers of transition. So I'd like to introduce you to Remy. He is a 19-year-old college student at the University of Denver here, and he has SMA type 2. He graduated high school. He was employed, he had an internship, and he actually even runs his own business. And as you can see here, these images are of the jewelry he makes and often shares with us in clinic. So we were very lucky. He was accepted to DU in September of 2020. And that was a huge accomplishment and major undertaking, as DU has significantly high expectations. The average GPA is 3.77 and average ACT score is 29. The difficulties and challenges that Remy experienced with transitioning to college started with hiring caregivers. It was a significant process in terms of interviewing, selecting candidates, getting them trained and hired through the nursing agency. So it was exhaustive. And unfortunately, he was not able to secure any nighttime nursing support. And ultimately, his mother needed to relocate to the dorms. So she left her family, her community, friends, and took up residence in the dorms. So I think this story highlights, despite all of the pieces being in place for independence, that transition can be extremely difficult both in life and the healthcare setting, faced with many challenges and barriers. And this is Remy. He is sharing his transition here with all of you.
Hi, my name is Remy St. Pierre, and I am a freshman here at the University of Denver. And my transition to college has definitely been a little bit difficult, challenging, but it's definitely been a good one. And I'm glad that I chose to go to college, and my experience has been overall pretty good. One of the first things that I did when I got accepted to the University of Denver is I communicated with the Disability Services Office, and they were able to help me get all of my accommodations in order for both education and housing. But one of the barriers that I was not expecting with them was sort of the disconnectedness between them and the other departments, meaning they can write the accommodation, but it's a lot to do with other departments that go with following through with them. Meaning, like with housing, they can write the accommodation, but the housing department has to do a lot of the heavy work. And so it's just not the smoothest process for me in most cases. But they were able to do a lot and just sort of help me get everything in order, including like the educational accommodations. And they made it so that I can have extra time if I need it, or anything like that. One thing that my medical providers were able to do is write that I need those accommodations so that the Disability Services Office can actually write the accommodation. So that was definitely a good plus. So another barrier that I faced was hiring caregivers. And one of the difficulties with that wasn't necessarily with getting caregivers, because I decided to hire students, and that was definitely a great choice because they're on the same schedule, so they're doing the same things that I am. So that's a really nice aspect of being on the college campus, is a lot of people are in the same situation that you are. But the issue that I ran into was actually with the caregiver company and the agency that they were hired through. So it's definitely difficult, and it's a process that I should have started a lot earlier than we did. And I don't know that like medical providers could do anything to make the process easier, but it's just not the most fluent process, I guess, of getting the caregiver company and onboarding all the caregivers, and making sure that Medicaid is in order, especially if you're moving from one place to another like I did. Overall, I felt pretty prepared for the entire process of transitioning to college, but I don't know that there's anything that I could have done differently that would make it easier, or that my doctors or anyone could have done. It's definitely just a difficult process and takes a little bit of getting used to. But yeah, thank you.
Thanks, Remy. I really liked this kind of cartoon picture, as I think it emphasizes the importance of hospitals and medical professionals to establish and continue to develop their transition programs and help navigate a lot of these barriers, and that we can't transfer patients with their umbilical cord still attached. Also, just defining transfer versus transition. I think it's important to recognize the differences, where transition really is, as defined by the Society of Adolescent Medicine, a more purposeful and planned movement of adolescents and young adults with chronic physical and medical conditions, from a child-centered care to more of an adult healthcare system. And I also want to include here that it's also important that other transitions in life, so leaving home, going to college, living independently, living without parent involvement, are also transitions in life and something that the healthcare system can support. And transfer is merely just the movement of patients from one medical facility or care provider to another. So at our institution, our experience with initiating a transition program started in 2018, where our now Chief Medical Officer, Dr. Brumbaugh, identified this need and wanted to create a more purposeful outpatient transition program. Up until then, it was more individual clinics working on transition efforts. So the first step that we identified was team members that were interested within each section of transition. And I think it's also important here to engage a lot of people with various backgrounds. So physicians, nursing, social work, physical therapists, neuropsychologists, to be a part of these efforts. And then these team members all got together, we sat down and discussed what was working well and things that needed improvement. And then from these discussions, a survey was developed and distributed across the hospital to various departments. And based on the survey results, themes started to emerge. And from these themes, 4 separate working groups were identified, and these included an electronic medical record group, an adult model of care, resources, and education. And each of these groups were partnered with a adult stakeholder. So we meet as a group monthly to kind of work on transition efforts. And then all of the stakeholders meet quarterly to update each other on our efforts. So in our incorporating transition to the Neuromuscular Clinic at Children's Hospital Colorado, it continues to evolve and develop with the changing landscape of pediatric care and new treatment therapies. But we have identified 14 years of age to initiate a more purposeful and planned effort in addressing transition. They're often entering high school at this time, so we do encourage patients to visit with their high school prior to starting kind of planning their schedule, access to elevator, and working on their IEP or 504. They're also masters of technology at this time. Their friends are life, and they're often going through a lot of physical changes and body image. So at 14, we encourage time alone with a provider. This actually is often our physical therapist who takes them away and does a lot of testing and has an opportunity to talk with them one-on-one and also kind of communicate any sensitive issues that might be going on with the rest of the team. We also increase their involvement in the discussions with the medical team. The proxy access in the electronic medical record is more restrictive to specific information. And at 14, patients are now allowed to have their own by chart access. So through the ages of 15 to 17, all patients are discussed and reviewed prior to their upcoming neuromuscular appointment. We review any previous discussions about transitions that have occurred. It's also a time where they're developing a sense of direction and forming a strong identity. So I think clarifying with patients and educating them on items that they can be more responsible and taking that responsibility of, so medication refills, appointments, any labs that need to be done, and all of this could be a good space to put in their after visit summary. They might be thinking about driving, so connecting them with adaptive driving facilities in their area, and also thinking about referring them to vocational rehab to help with independence and employment. And starting around the age of 18, adulthood is ahead, and we have at that time restricted any proxy access to their electronic medical record. It's important to ensure all of the information in their chart is under their name, so including their address, contact information, insurance. They will also be the ones who need to consent to treat and also release any information. They might be going off to college, so certainly helping with them identify the disability center and meeting with the disability center, meeting with housing, and helping with those transitions as well. This is a transition planning tool that we have in our EMR, and it is a continuum over time that works on planning with the patient and family. And tracks their progress along the way, and when they have successfully completed some of these transition items. So knowing their diagnosis information, knowing why they take medications, how they obtain refills for these medications, and also emergency planning information. So who to call when they're not feeling well, and what numbers do they call. So this is a nice tool that can be worked on over time over several years. And this is an article that appeared in Pediatrics by Christina Trout, and it is for Duchenne muscular dystrophy, but I think a lot of the information could be also applicable to patients with SMA. It includes a readiness assessment, so identifying things that they need to plan for, what they need to learn, and what they've mastered. It also includes a checklist, and it goes through a lot of the different domains, including education, employment, housing, transportation, their activities of daily living, and also provides a lot of resources for young adults in the United States. So you can kind of follow what they might need help with, what kind of they're working on, and when they are ready to transition. So at our center, we generally have adopted the rule of a year after high school or college to transition their care from the pediatric center to the adult center, which actually is quite nice here. We are just across the street. We're all on the same campus, so it's not a far move, but definitely that street seems quite large at times to cross. We do provide them with a transition letter, and it includes all of the pertinent information and contact at the adult center and the anticipatory guidance of what that adult model of care will look like. So about 6 months after their transfer of care, we do a follow-up phone questionnaire and just identifying if they've actually had their initial visit with the adult center, if there were any barriers to that process, so we could improve upon future transitions. And this is Zoe Grisey. She is another patient with SMA type 2. And I apologize for the video. It kind of moved over to the side, but you'll see her still picture.
Can you start by telling me who you are?
Hi, my name is Zoe Grisey. I'm 19 years old and I have SMA type 2, and I'm a second year at the University of Denver.
So the transition from high school to college can be pretty stressful for any student, let alone a student with disabilities and medical needs such as yourself. What sort of things did you personally do, not academically and not looking at the school, but how did you prepare yourself for the transition of being a young adult?
My mom started to bring in outside caregivers early on in high school. That way I was okay with the idea of other people taking care of me, and it didn't always have to be her. That really prepared me for the idea of doing anything, really.
And the stress and emotional toll that it comes with going to college and setting out on your own, did you talk to anybody? Were there any services for you to address the issues that you personally have being disabled?
There's not a specific specialty for young adults with disabilities, but I did go see a psychologist at the rehab center at Children's Hospital. She was very helpful because she helped kids who had like sports injuries and stuff. That was as close as I got, but she was very helpful in helping me process my emotions that any teenager has. And she had a little bit more expertise on disabilities.
So do you feel there's a gap in that particular market and support?
For sure. There needs to be someone who specializes in neuromuscular diseases specifically too, because I'm not mentally disabled. It's just the physical disability that slows me down. And I go through different things that my peers don't. And so do my parents. My parents go through things that my peers' parents don't. And there's definitely a gap.
So I appreciate those patients sharing their stories. I think it's very helpful to hear directly from them what some of the difficulties they've had experiencing. I'd like to turn it over to Melissa Au, and she will be sharing with you about social services and the MDA.
Thank you, Allison. Let me share my screen. Sorry. All right. Hello, everyone. My name is Melissa Au, and I am the Director of Clinical Engagement and Support for the West Region for the Muscular Dystrophy Association. So how does MDA fit into this conversation, and what do we do? For 70 years, MDA has been committed to helping kids and adults with muscular dystrophy and related life-threatening diseases live longer and live stronger. So what exactly is our mission? We are committed to transforming the lives of people affected by muscular dystrophy, ALS, and related neuromuscular diseases. And as a nationwide organization that is committed to transforming the lives of people affected by muscular dystrophy, ALS, and related neuromuscular diseases, we are doing this through innovations in science and innovations in care. As an umbrella organization for more than 43 neuromuscular diseases, we are committed to transforming the lives of people living with neuromuscular disease by supporting research to advance treatments and discover the breakthroughs that one day lead to cures, as well as providing programs to enrich patients' lives. In fact, no other nonprofit supports so many neuromuscular diseases. So why is focusing on so many diseases so important? Because what we learn from research in one neuromuscular disease can help advance the treatment in others. While innovations in science is one of our core capabilities, innovations in care is keeping pace. And here are just some of our current highlights of what we currently offer. Our MDA Care Centers is where we support the largest network of care centers providing best-in-class comprehensive clinical care at top healthcare institutions like Stanford. We also have our MDA Resource Center, which is our national resource center staffed by a dedicated team of knowledgeable specialists offering one-on-one support at no cost. And our recreation programs. MDA offers many recreation programs at no cost to families. And one of our well-known programs is our summer camp program, where it's a place where every year thousands of children and young adults learn vital life skills and independence. At MDA, we feel like no one should ever have to navigate their neuromuscular disease journey alone. And we're always there to help, often right within families' communities. Topping the list of services from MDA are specialized medical care through our care centers and our individualized support through our MDA Resource Center. Our care centers provide access to specialized care and much more. These centers are home to the most advanced research and treatment methods. Many serve as clinical trial sites for the latest experimental therapies and provide best-in-class care at over 150 of the nation's top medical institutions across the US. The Care Center Network conducts over 90,000 medical visits annually for more than 60,000 individuals living with muscular dystrophy, ALS, and related neuromuscular diseases, and includes more than 2,000 clinical providers. For families that are in more rural or remote areas of the country or are without convenient access to a care center, our resource center team offers a solution for real-time interaction and communication with specialists. Any question a person might have regarding MDA support or services can usually be answered by our staff. We also have a team of care specialists that work collaboratively with our resource center team through a pooled virtual approach to provide seamless communication and support to our families. Another great resource I want to highlight is MDA has a webpage dedicated to our young adult clients with helpful information to guide them through their ongoing life changes. There are some great resources for scholarships, how to find and hire a caregiver, how to find affordable and accessible housing, how to become an advocate for the neuromuscular community, and so much more. For more one-on-one assistance or guidance, we usually encourage individuals to reach out to our care center, either by phone or by email, and they will usually get in touch with the individuals that reach out in a timely manner. And it's important to point out once again that we are truly entering a new era in neuromuscular disease where the prospects for transformation has never been brighter. More and more treatments are being developed and better support and understanding of the disease and of people's needs. And so lots to look forward to. This concludes my portion of the presentation and wanted to go into Q&A. Let me see if anything has come up.
I don't see any questions.
There's several in Whova. So if you look over in Whova, there's several there. Let's see if I can pick some out for you.
Okay, let's see.
How common are transition programs? We started one a few years ago at CHOP, and our success with transition of patients has been far more successful than in the past. And you kind of addressed that, but I do think this is a growing awareness. I don't know if you have comments about that.
Yeah, I agree. I think transition programs have been kind of an ongoing development. I think what is important is that hospital buy-in from at a hospital level to support transition. So a lot of things that can be implemented across multiple clinics and departments, as well as the specific department initiating their efforts and connecting with the adult providers.
That's great. There's also a question about whether or not you have any issues with parents not allowing the kids to participate in the transition program.
I think that certainly is a challenge where we're trying to initiate some of these efforts, and the parent is the barrier to making this successful. And so I think that's what's great about the multidisciplinary teams and kind of utilizing your team to continue to address and impact these important issues.
I think you said that the physical therapist is the one who establishes a more one-on-one relationship with the patient. Is that always the case at your program? And how did you make that strategic decision?
You know, it is, and it happened quite naturally. I think starting at a young age, the kids perform much better without their parents in the room. And it's been really fun to be a part of that visit and kind of tag along and see how different the kids interact with the physical therapist when they're alone without their parent in the room. And it is established at such an early age and becomes so integrated into the clinic that when they're hitting some of those tougher years, it's just continuing that process. And really, she's the one who identifies a lot of some of the sensitive topics that come up with the patient.
Well, thank you both very much. That was a really engaging discussion and an important issue.